Hi, Tina.
You got to start over.
That was such a good one, too.
Okay, do it just like that.
Okay, hold on. Hi, Tina.
Hi, Leah.
No, that's too enthusiastic. No, that's too much. Hi, Tina.
Hi, Leah. How's it going?
It's going awesome. I just tallied up the score of our Survivorship song contest
On Instagram?
Yeah, where I had kind of put it out there, like, what song represents survivorship to you? And we got about 10 nominees.
Nice.
And then the people spoke, and we have a winning song.
All right. I honestly don't know what it is, so give it to me.
The winning song, and it was close. It was pretty close, but the song that won was Shake It Out by Florence and the Machine.
Oh, okay. Yeah.
Yeah.
I actually know that one.
Oh, cool. That's so unusual.
I know. Oh.
And then what came in second, in a very close second, was Boulevard of Broken Dreams by Green Day.
Which I probably know if I heard, but
you'd know if you heard it. Yeah.
Titles. And it's when titles aren't the actual refrain of the song.
Yeah. No, I mean, you would know the song if you heard it. And then number 3 was I'm Still Standing by Elton John.
Sure. Okay.
You know that.
That one I know. Again, the refrain of the song is the title, so that helps.
That does help. But no, there were some really good nominees and some songs that I wasn't familiar with. I mean, the winning song was going to go on our Spotify playlist, but I might throw a couple up there that I thought were really great songs that I don't think a lot of people are familiar with, because I like the obscure songs. So,
well, let me ask you this. You had 10 songs?
Yes.
What stops us from putting all 10 up there?
Well, it was a contest.
They can have our undying gratitude for choosing the most popular one.
That's true. Maybe I'll do that. We'll see. We'll play it by ear. But yeah, I could do that.
All right. We'll see.
We'll figure it out.
We'll take it to our council.
Exactly.
We'll bring that to our board.
We'll take it to the Cancer Pod Council. It's like the Vampire Council. We'll take it to the council and they will determine it. Okay. So, Tina, we are starting a pod on survivorship.
Mm-hmm.
So what's interesting with some of these songs is some of the songs were like Fighter by Christina Aguilera or Survivor by Destiny's Child. And then there's Boulevard of Broken Dreams by Green Day. I mean, there's really dramatic, like, either it's survivorship means positive to me or like survivorship is a freaking slog.
Mm-hmm.
So what's the definition of survivorship?
Yeah. So, what interesting about the word survivor in general is that some people take to it and other people abhor the word, like can't stand it.
Right. It can be polarizing.
Yeah. I've had a lot of patients in the past say they don't like it. They don't like to be considered a survivor. They don't like the connotation of the word.
Is it because it's like one of those kind of battle terms, like fighter and survivor?
Yeah. I guess to some people it's not enough. Like I'm more than a survivor. I want to be a thriver. I want to be healthy and well. I don't want to just survive.
Oh, okay. So that's like really kind of literal.
Yeah. Yeah. I think that's from what I've gotten back, feedback I've gotten back from patients. But I would always tell them the story of how the term even came around. Survivors and survivorship is not a term we've always had. It actually arose in the mid-1980s. And who is credited with the word is a doctor. His name is Fitzhugh Mullen.
Okay.
Mullen. And he's a doctor, right? And he was already a physician at the time that he himself was diagnosed with cancer. He went through some intense surgeries and intense treatments, and he then wrote about it in a paper. And the title of the paper was, I believe it was Seasons of Survival. And he went through seasons of survival. Like he survived this intense cancer treatment. He's on the other side. I think he was late 30s, early 40s, somewhere in that range. He wrote about the seasons of survival and he defined them as acute, extended, and permanent, which was interesting, right? So active treatment was the acute season of survival. And then extended season of survival was considered the 5-year period after treatment. And then for those who didn't have a recurrence, he called it a permanent season of survival. And they had different challenges, different physical challenges, mental challenges. So he's writing to his colleagues to apprise them of the experience as a patient and how he tried to capture how the patient's needs change over time and that you're a survivor from the time of diagnosis onward. The entire reason for doing this was to advocate for patients, to say, it's not like life just resumes to normal. You are now changed in some way. And so he was trying to begin that dialogue. And I think that was the beginning of really looking at this post-treatment period. Of course, our treatments were getting better, so we were having a higher number of people who actually went through treatment and went on to lead a long life. And so he wanted his fellow colleagues to define it differently and to acknowledge it mostly, that the needs vary.
And I think that is such a hot issue right now. It seems like there are more and more younger people who are being diagnosed and like, is this what my life is going to be like? Is this how it's going to be for, however many decades I have or however many years, whatever your future holds? Is this what it's going to be like? The side effects can go on. And what was the number that we found? How many cancer survivors there are?
So the estimates for the number of cancer survivors keeps going up, and they're estimating 22 million cancer survivors in the next decade. And that's just based on the aging population. That doesn't take into account improvements in treatment. But I think it's going to be higher.
That's in the US?
Yeah, that's in the United States.
So, that's a heck of a lot of people. And, the side effects that we're going to be discussing in this pod, these are also side effects that are experienced by patients in active treatment. So the number one concern of cancer survivors that I hear is fatigue. And fatigue starts with treatment. I remember when I started my treatment for breast cancer, when I started the adriamycin Cytoxan, and I had my first cycle. And I was walking down the hall and I ran into my surgeon and he asked how I was doing. And I was like, oh, I am tired. And he's like, already? And I was like, yes, I'm working full time and I'm going through chemotherapy already. But then it just kind of snowballed from there. And it's the type of fatigue is, I'm sure your patients have tried to describe it to you. It is like this fatigue that comes from your cells. It's like every cell in your body is fatigued and it's overwhelming.
So you're saying mental fatigue, emotional fatigue, physical fatigue.
Yeah, just like every single part of you. If you have hair, your hair would be fatigued. And it would just come over you like a huge tidal wave and just, yeah. And it still does. Every once in a while, I'll just feel this overwhelming fatigue. And I'll tell my husband, this is like chemo fatigue. I don't know what's going on.
Right.
And this is 7 years out. I think I have, maybe I should know this. Doing the math in my head.
7-ish. Well, during treatment, I think it hits you rather suddenly, right? Especially if you're getting something like chemotherapy or certain types of treatment that lead to anemia rather quickly.
Radiation, big one.
Yeah. You go from normal red blood cell counts to anemia in the matter of, days or weeks. You're going to feel that more profoundly than if you developed anemia over the course of months or years, in, for example, women with iron deficiency anemia out there, right? That's rather common in cycling women. But they don't feel that profound fatigue like you do during chemo because it's kind of like you hit a wall.
Right.
Let me ask you this. You said it kind of comes and goes. Do you have normal energy on some days? Most days?
Define normal.
Pre-treatment.
Well, it's also different, right? I'm not doing the same things I was doing pre-treatment. Pre-treatment, I was working full time, and now I'm not. I'm busy most days, but it's just different. It's like I have a different life that's happening right now, so it's hard to say if it's the same type of fatigue or not.
So for today's discussion, shall we stick to post-treatment fatigue?
Yeah, I think we should stick to post-treatment fatigue, but some of this can apply to anyone who is currently going through treatment. But, before trying anything new, they would need to check with their doctor.
Okay.
And for people who are post-treatment, but maybe they're on something like an aromatase inhibitor, or they are on ongoing treatment. I mean, obviously check with your doctor too. Check with your doctor.
So let's talk about some contributing factors and causes.
Absolutely.
Post-treatment fatigue.
Post-treatment fatigue. So the NCCN guidelines had mentioned that comorbidities would be a cause of fatigue. And I just want to kind of get those out of the way because those, I mean, we could spend days talking about that.
So when you say comorbidities, what you mean is other conditions that are happening at the same time.
Right. That would be unrelated. Well, it could be related or unrelated to their cancer. So a condition like hypothyroidism, low thyroid function, especially after getting radiation to the head and neck.
Okay. Yeah. According to the NCCN guidelines for cancer-related fatigue, that includes things like pain, emotional distress, sleep disturbance, which we've covered in depth in a part 1 and part 2 podcast and in the past, alcohol or any substance abuse. And they also include other conditions, so concomitant conditions that might be contributing, like a heart issue, that kind of thing. They put cancer treatment sequelae, which would include several of the things I just mentioned. So some of those things, whether it's neuropathy, some pain, or emotional distress because people are anxious about recurrence, there can be a lot of sequelae from treatment that lead to contributing factors for fatigue.
Right. And I would think, I don't think it's on the list, but I would include things like, brain fog or chemo brain. I mean, that's exhausting trying to manage your life when you're living in a land of brain farts. I mean, it's tiring.
Yeah. So you mean the energy it takes to just function on a day-to-day.
Yeah, I think for some people, for sure.
Yeah, that makes sense. Yeah, and they did mention in the NCCN guidelines, they did mention that fatigue seldom occurs by itself, is how they put it. And they said it usually occurs alongside one of 3 things: sleep disturbance, emotional distress, which is depression or anxiety, or pain of some kind. And so I thought that was an interesting thing. And they were saying cumulatively, when you look at studies looking at cancer-related fatigue, they say it usually goes alongside one or more of those.
Interesting. So what's going on like in our bodies metabolically in terms of fatigue?
So a large part of the fatigue, cancer-related fatigue, can be due to the hypothalamic pituitary adrenal axis dysfunction.
Oh, the HPA axis.
So the classic HPA axis. And if you don't know about it, if you haven't heard about it or read about it, the HPA axis is responsible for our circadian rhythm. It's also the system we use, or at least it gets engaged during fight or flight. And so due to a lot of things that happen during treatment, this system can be dysregulated afterwards. This includes things like steroids during treatment can throw off the HPA axis, stress, anxiety, being in that fight or flight mode chronically, maybe, or at least, maybe a lot more anxiety than the body normally has. That all triggers the HPA axis. And so by the time someone goes through treatment and comes out the other side, sometimes the HPA axis needs to be reestablished. We need to put together some lifestyle measures.
To reset it.
Basically reset it. It's like this. Cortisol goes up when you're stressed out. Steroids like dexamethasone, prednisone, those kind of things, mimic our own cortisol. Cortisol's job when we have a burst of cortisol, like I always use the car as an example because this happens to anyone who's driving. Someone, goes out in front of you and you get, this jolt. That jolt includes not just your adrenaline jumps, which is another word for epinephrine, adrenaline. Your cortisol also goes up right then. And it tells your hypothalamic pituitary axis to produce a big burst of cortisol. But once it's high, that high amount of cortisol goes up to your hypothalamic pituitary axis and your brain goes, oh, there's a big burst. Let's stop making it. It's like a knee-jerk reaction. You have a burst of cortisol and then you stop and you get over it. When you're on steroids or you're under constant stress, imagine the cortisol is constantly high. It no longer responds. It doesn't shut off. It creates this continuous loop of high cortisol, and that's a chronic stress pattern. And what you're asking of your own adrenal glands when you're under chronic stress is to continually make cortisol. And at some point, it can't do that anymore. The old term, and not a very well-liked term these days, is adrenal fatigue or adrenal exhaustion.
That's kind of considered woo-woo.
It's definitely considered woo-woo. It's a very colloquial term too. I mean, I think it conveys the end result in that the adrenal glands are not creating enough cortisol to have a normal rhythm. So you can end up with a low cortisol state eventually, but it's not a truism. It's not like your adrenal glands are actually fatigued or exhausted in any way.
It's old school.
It's definitely old school. So back to this rhythmicity. So when you're under chronic stress and your HPA axis stops hearing the high cortisol, I'm going to put that in air quotes, hearing that there's high cortisol and it's not able to come down, it keeps the cortisol high. High cortisol throughout the day and throughout the night will disturb your sleep, cause anxiety, and it's linked to higher rates of recurrence. So high cortisol, consistently high cortisol, where it doesn't come down in the nighttime. After dinner time, our cortisol should continue to go down, down, down. Dinner time, nighttime, you put your head on the pillow, your cortisol should be at its lowest point, and it stays low throughout your sleep, and then it jumps back up in the morning. And so that's part of the 24-hour rhythm of our cortisol, right? So we have this anxiety-provoked, stress-provoked high cortisol state that we should come down off of if we're healthy and resilient, if our HPA axis is resilient. And then we have this 24-hour background of cortisol. So these are the two ways the HPA axis keeps us healthy. The 24-hour rhythmicity of your cortisol can be thrown off by that high cortisol state when you're in that high stress mode for a long time. If you continue that, it can lead to sleep disturbance. And like I said, it is associated in studies with higher rates of recurrence for at least breast, renal, and ovarian cancer at the very least, and there's probably others. So what we'll talk about when we go into the lifestyle factors and things that we can do to help, we'll talk about the HPA axis and how to get that normal rhythm back, because foundational to health is having a normal circadian rhythm, 24-hour rhythmicity of your cortisol pattern.
So what you're saying is, obviously, any comorbidities need to be addressed. If there is depression going on, if there is chronic pain, those need to be addressed. But the foundation would be addressing the HPA axis, I'm assuming.
So you have the comorbidities, right? So the pain, sleep disturbance, all of these things are overlapping, right? So pain could be causing the sleep disturbance. The lack of circadian rhythm can cause sleep disturbance. Anxiety could cause sleep disturbance. Like, I don't think that we can necessarily pull them apart completely because there's so many overlapping features.
Right.
And the NCCN guidelines does recognize the HPA axis dysfunction as a major part of cancer-related fatigue.
And other things that could be going on include things like inflammation, right?
Yes, systemic inflammation is associated with fatigue, along with a lot of the other sequelae of cancer treatment, like brain fog, neuropathy, aches and pains, arthritis, muscle pains. Yeah. So systemic inflammation is definitely something that should be on the table. And that can be checked pretty easily with just doing an ESR and a CRP on labs, especially the CRP, which is C-reactive protein. I think it should be ordered on labs, wellness panels for people who are getting their blood work done post-treatment to see where that's at, because things can be done to bring it down. And generally, when you lower the CRP, you feel better. I mean, whatever the inflammatory symptom you're having, is usually relieved with bringing down the CRP. So the other piece of the metabolic things that are happening post-treatment, and some of this is ongoing. So some people are taking a drug, whether it's tamoxifen, a aromatase inhibitor, or maybe one of these tyrosine kinase inhibitors for treatment. Another thing that happens is mitochondria of the cells can be impaired, even destroyed. So constantly we are regenerating mitochondria in our cells. Energy manufacturing within the cells themselves is the mitochondria. So some drugs are directly toxic to the mitochondria, but certainly when you go through treatment, at least stress to the point of some destruction. And what regenerates our mitochondria is exercise. So we go through phases of creating more mitochondria within cells when we demand more energy from the cells. So maybe you had to rest a lot more than usual. You didn't have energy because of your anemia, so you weren't up and about as much during treatment. That means the number of mitochondria per cell is going to go down because it will go up as needed, right? So the mitochondria damage directly or indirectly is also one of the reasons that there's fatigue afterwards.
So that's a great case for trying your darndest to do some form of exercise during treatment.
Yeah. All the studies show that movement is your friend.
Yeah.
Yes.
And when you're, when you have one of those waves of fatigue come over you, sometimes that just seems hard to do. I used to write prescriptions for my patients to dance.
Oh.
I believe that everyone has a song that gets them to dance. And so I would tell them, put it on your phone, just have it where you could just like push a button and just move. Even if you're laying on your bed, just like put your legs up and dance on the ceiling. So, just to get people moving. So I guess that we're kind of moving on to what is helpful. And we've mentioned exercise.
Yeah. Yeah. Exercise is interesting because going back to that HPA axis, it can be very calming. Like you go for a walk or you do some gentle exercise, yoga. Most yoga would count, walking your dog, that kind of thing. It can lower cortisol. So that's what you want to do after dinner or in the evening. You don't want to do vigorous exercise after a certain time in the day, like mid-afternoon. After mid-afternoon is when you don't want to be doing vigorous exercise because vigorous exercise raises your cortisol level. And that's a time of day that you kind of want it to be going down on the downward slope certainly after 2, 3 o'clock in the afternoon. And by the time you go to bed, like I said, it's good and low. So you want to do calming things in the evening, more vigorous activity earlier in the day.
And so the recommendation in terms of cancer survivorship for exercise is 150 minutes of exercise per week. And that includes aerobic exercise and resistance training. So that can talk about overwhelming. I mean, you're just doing the math. Like that seems like a lot of exercise, but it can be broken down. You can go for a 5-minute walk. You can then do maybe 20 minutes of resistance training. So let's round it. Let's say it's half an hour a day. But if you don't have the time to, go to a gym for half an hour, you can break it up. And so maybe going for a brisk walk earlier in the day and then at night doing a little bit of like wind down yoga. That could be a way to incorporate it into a busy schedule.
Yeah, I think that's a really good idea, especially during treatment, right?
But even after treatment, when suddenly, you're back at work and then you've got the kids and all of this, it's like, how do you squeeze that into your day? Just knowing that half an hour a day of exercise plus or minus, a few minutes does not have to be consecutive.
Yeah. And by moderate is generally defined as not being able to have a long-winded conversation like we're having right now, but to being...
You call me long-winded.
To be slightly incapable. So you're breathing too heavy to have this kind of conversation, but not so heavy that you're gasping for breath or, you're pushing your heart rate too high. So just so we're clear, moderate is somewhere between what we're doing now and being completely incapable of saying a full sentence.
So what I noticed when I was going through treatment, and then I still notice it like being on social media after treatment, is that there are people on Instagram who are posting pictures of themselves, training for races. I remember there was this one woman I followed when I was in treatment who was some sort of executive at a outdoor company here in the Portland area. And she's doing cartwheels on the beach and doing all of this stuff like while going through treatment. And I'm just laying on the couch thinking like, no. And I unfollowed her because I just couldn't deal with that pressure, that peer pressure to like do cartwheels on the beach when you can't even do that before cancer diagnosis. There is a lot of push for people to exercise. And in some ways, like the peer pressure is good. And in other ways, it's like, it's alienating, especially if someone doesn't have a history of exercise before diagnosis.
Yeah. That's why I usually use the word movement, because I don't think we should, especially if someone hasn't been exercising, suddenly say, yo, don't forget to do your weights.
Right.
So I think we need to be realistic and people need to check in with where they're at. More and more centers are beginning to put exercise as a department at the center, kind of like they've been doing for cardiovascular health. I think the oncology centers are coming around and saying we need our exercise center. And so there's more research going around this because there's plenty of research showing how exercise benefits people. And movement is enough during the treatment period. And afterwards, maybe working with a professional for a short amount of time for your own safety.
I mean, trainers.
Makes sense.
Yeah. And it would need to be somebody who is familiar with working with cancer patients.
Yeah. Yeah.
Some of the other kind of like non-drug treatments that are considered category 1 evidence by the NCCN would be yoga, which is movement, and massage.
Mm-hmm. Yeah, that's nice. Good excuse to get a massage.
Oh my gosh. Do you know how many people wish that it was covered by insurance? And I don't believe it's ever covered by insurance unless it's done in a physical therapy type of situation.
Yeah.
That is so unfortunate that massage is not covered by insurance.
Yeah. And other therapies like acupuncture, of course, which we always
I know.
It's
It's a given. I think what we should do is just always assume acupuncture is going to help with something. And if it doesn't, we'll bring it up then. So yeah, acupuncture is a given. Definitely it can be helpful. And again, I know we're talking about after treatment, but it does help during treatment as well. So there is a lot of that overlap. Yeah. And there's more and more evidence for yoga as being supportive for fatigue. And it doesn't have to be, when I was working at the cancer center, we would have yoga classes and a lot of them were restorative, and restorative yoga is great. But just because you're going through cancer treatment or you went through cancer treatment doesn't mean you need to stick with restorative yoga. You can do, more active yoga to help with fatigue. You probably want to end it kind of on a more mellow note.
So the other thing that at least NCCN guidelines point to is cognitive behavioral therapy, both for the fatigue as well as for sleep issues. Cognitive behavioral therapy is getting more and more validation in studies for various issues that arise. So that's something that I don't know how insurance treats this stuff. I really don't. I mean, maybe some programs, if it's at the cancer center, maybe it can be included. I don't know.
Yeah, I'm not sure either. But yeah, those are pretty much where like the guidelines stop. But there are studies showing other things can be beneficial, like diet and certain supplements.
Yeah. So one of the things to consider, especially immediately after treatment, is nutritional deficiencies, weight loss, muscle deconditioning, so atrophy of the muscle because it hasn't been used. So all of these things that can contribute to fatigue right after. So looking at nutrition, we talked about movement, so that would help with conditioning, but nutrition and making sure that there's no nutritional deficiencies, and that's everything from B vitamins to just proper caloric intake, right? Just making sure you're eating enough to have enough energy for your day.
There was an interesting post that I saw on Instagram. Crystal Zuniga, she's an oncology dietitian. She has her doctorate in nutrition. And she had a post that went over a study where over a 2-year period, they looked at patients stage 1 to stage 3 colorectal cancer. And they increased their fiber, fruit, and vegetable intake and showed improvements in fatigue over 2 years, just kind of like self-evaluating. So if anyone is interested in that, they can check out Dr. Zuniga's Instagram, which is Cancer Nutrition HQ. She's got a lot of good info.
That's great. I think the biggest thing is to eat real food.
And when you're tired, it's not always easy, but there are workarounds.
Yeah, I think some of the pre-prepared meals that are being delivered, some of them are getting rather healthy. So I know in some areas there is actually services that will deliver free meals that are very healthy. The Bay Area has some of that going on. The Eugene, Oregon. I think they've evolved to beyond cancer treatment. Basically, it's chefs that volunteer, and they get together with high school kids usually who are volunteers, and then some people who will deliver, and they have gleaners out there gleaning out of the fields of whatever is in season. It's kind of an amazing service.
There's one in the Phoenix area, the Joy Bus Diner.
Okay.
And they actually had a physical diner too. And so you could go there, and we'd go there. Sometimes it was right near our house. And so we'd go and have breakfast there. But they also had a service, but that was for people who were in active treatment. In terms of like those, the food prep boxes, we did Hungry Root for a while, and that's all plant-based. Well, I think now they've changed it. It's now they've expanded to beyond vegan. But those were really simple, and it seemed to have, it's a lot of packaging waste, but it's an option. And I think of things like those prepared salad bags, and Trader Joe's is always my go-to for something that it's like you can kind of buy it. It's like almost prepped, and then you doctor it up and throw in more veggies or something. So there are workarounds for if you're just a little too tired to cook all the time.
Yeah. Yeah. And one thing people can do is get a like a Vitamixer or something similar, like a high powered blender, NutriBullet, and do something most days of the week. And my favorite thing to advocate for is greens and a fruit. I don't care about the green or the fruit, whatever you like to put together, whether it's kale and apples.
And spinach is pretty benign. Like, I mean, spinach of all of the greens, kale can really, you need something sweet and maybe a little bit of lemon or something to kind of mellow that out. But spinach is easy to disguise if you're trying to disguise it for yourself. And then throw in some chocolate and you're good. No, I used to make a smoothie at work, and it was mango, spinach, coconut water, apple, cinnamon, and some ground flax. And then I think vanilla protein powder. And I called it the Applejack because it kind of tasted like Apple Jacks, which isn't a bad taste. I mean, if you're like 6-year-old kid.
But yeah, you can doctor it up as much as you want. Put a little apple cider or some coconut water or whatever you have handy. You don't want it to be too high in sugar, but generally the more bitter the green, the sweeter the fruit you need to oppose it.
And that's why I added the ground flax, like how fiber slows down sugar absorption. So.
Yeah, that's why I advocate for NutriBullets, Vitamixes, things that keep the whole plant together.
You're not juicing.
Right, so that you're getting the fiber. Not just the juice, because that just extracts all that fiber and you end up putting in compost or your garbage. And
you can cook it back, put it into foods. But yeah, our dietitians always recommended if someone was going to juice, to not have the juice as the meal, but to juice with the meal, because otherwise it's sugar and then you have a sugar crash and then you're tired again. And real quick, just one thing about sugar. Sugar is one of those things where it can create like a vicious cycle. So like caffeine, right? I mean, you have your treat at like 3 p.m., you're feeling a little run down. You might have a little coffee drink, maybe some sweet, some pastry or whatever. And then you crash again. And so just trying to avoid that that cycle of refined carbs and caffeine, which may just perpetuate the fatigue. So focusing more on the nutrients in food to help to provide the energy.
Yes. And the idea of getting these micronutrients, this is a lot easier than figuring out what to cook all the time. That's why it's kind of a little bit of coverage, a little safety net of nutrients that you would be getting.
To do, doing the smoothies.
Yeah, maybe you're too tired to cook every meal with a bunch of vegetables and, cut and chop and cook and do all of that. But if you can do a blended Vitamix or whatever most days of the week, then you would have this kind of safety net of plants going in your body, which I think is the most important part is getting them in.
And you could do soups with those too, right? Like, because I don't have a Vitamix, surprisingly. I know, right? I don't even have a Ninja.
What?
Oh. No, it's because I want one that has a glass thingy, a glass.
Oh.
My blender has a glass. What is that thing called? Pitcher.
Got it.
I wanted one, but I don't think they exist. But anyways, we digress. You can make soups in those things, from what I hear. You can heat them up.
Yeah, you can. Yes, you can make a nice cream soup in those too. Yes, it's true. Or creamless cream,
Oh yeah,
whatever.
A little bit of coconut milk. I should keep posting recipes.
We're also heading towards our lunch.
I know. We're obviously
hours.
doing this during lunch because we're like stuck on the food part. All right. So making sure that your macronutrient and micronutrient needs are met. We are not advocating for taking a multivitamin. We are advocating for eating food.
But if someone wants to take a multivitamin, are we advocating against it?
We're not advocating against it. We just don't know what's going on with everybody. And so to say blanket, like you have to be taking a multivitamin, that's not, I'm speaking for both of us, but I think you agree.
See. No, I totally agree. You are unlikely to do any harm with whole food diet, and everything should come from the diet. Yes, agreed. I think some people, at least the short term after treatment, when you really need intensive repair and healing of tissue and getting your counts back, your blood counts, your white count and your red cell count back, and taking a multivitamin for a short period of time doesn't seem unreasonable to me. And a really general multivitamin. I'm not a big fan of using mega doses of anything.
Absolutely not.
Doesn't
Yeah,
matter.
me too.
B vitamins, mega doses of anything, unless I know exactly why I'm giving it to that person because of their particular physiology demands that. Because when you give the high dose of any vitamin, you're giving a high dose of what is basically a cofactor for a chemical reaction. And by giving a high dose, you can actually affect that chemical reaction in the body such that it goes faster, it becomes more efficient. Sometimes you want to do that, and sometimes you don't. So I wouldn't do it willy-nilly. I would do it very selectively and because there's a need for a high dose of a nutrient.
Yeah, I mean, I think there was like that, I don't want to say it's a fad, but there was sort of a movement for really high dose vitamins. You see these capsules and it's like take 6 a day. I would have patients bring me these things and they're like, I heard this was really good. It says to take 6 capsules a day. And I'm like, how, the dietitian tells me that you're eating well. So let's take 1. Let's take 2,
I totally agree. And I say B vitamins because often B vitamins come with way more than people need, like 12,000% of the B12 one needs daily. I think that those can be playing with physiology. We don't know exactly what's happening with all the high dose stuff altogether.
Yeah. High dose A was another big one that people were doing for a while. So yeah, there also are some herbs, and especially like when you're talking about the HPA axis, there are supplements. I'm not even going to just categorize like herbs, like it's just there are supplements that help to support that. I guess adaptogens is the term that a lot of people throw around.
Yeah, they help you adapt to stress. So they're called adaptogens. So plants that are adaptogens are the ginsengs, so whether it's Siberian ginseng, Chinese ginseng, Korean ginseng, they're all considered adaptogenic plant. Rhodiola is in there, withania. They all have slightly different actions, even though they're all called adaptogens. Some of them are more calming or sedating. Some of them are more stimulatory. So you do need to know which one to use. Probably the one that there's decent evidence on and is probably the least likely to cause issues is American ginseng. It's a fairly neutral adaptogenic plant. American ginseng has some nice studies on fatigue during treatment that showed that those who took American ginseng had less fatigue. And we generally, anyone who uses herbs knows that the ginseng plants are there for this very purpose. I mean, we use them to help bring that rhythmicity back, that circadian rhythm back. So generally speaking, adaptogenic plants are used in the morning, early afternoon. We don't usually dose them in the evening. There are some adaptogens that are more sedating, like I said, so we might selectively do that here and there. But for the most part, when we're talking about the ginsengs in particular, you're talking about early day when you want to give support to the energy processes of the body, enough cortisol during the earlier parts of the day to have energy.
I want to add something about starting adaptogens. When a person starts something like ashwagandha or one of the other adaptogens that we mentioned, and remember, don't start anything without first talking to your doctor. Don't start with like a high dose. Don't start with the big guns. Like ease in. Start slow. Don't go from like 0 to 60. Like you want to definitely start with a lower dose, maybe start with something like a tea, something that isn't as potent.
Yeah, I totally agree. It's too stimulatory for some people if they start too quickly.
Yeah, and then you're just uncomfortable and then you don't want to do it at all. So it's a slow process. So start gentle.
Good point. Let's see, what else?
And so one of the things that I think of also that helps to support the HPA axis is it's vitamin C.
Yeah, especially during severe stress, right? This is when we need more vitamin C.
What I find interesting about vitamin C is that many animals produce their own, and humans and a few other animals like guinea pigs have to get it from their diet.
I did not know guinea pigs could not.
Oh, you didn't know that?
Mm-mm.
Fun fact, humans and guinea pigs. Yeah, I always thought that was really cool. So, vitamin C is good for so many things, but it can also help with how the body processes stress.
Yeah, I think it normalizes some of that feedback mechanisms where the cortisol triggers or doesn't trigger the hypothalamic pituitary axis. And so it helps normalize that during high stress. The B vitamins that are involved are B1 and B5, and then L-tyrosine is also useful for fatigue.
So tyrosine is found in animal products. It's also found in nuts and seeds and whole grains. But yeah, beef, pork, fish, chicken, tofu, dairy.
Yeah.
And so like, I think of for people who get really tired, like I always talk about like, oh, well, just, grab a snack of some raw nuts and seeds. And so maybe it's the tyrosine that's helping them.
Maybe.
So you mentioned for B vitamins, you mentioned thiamine, which is B1, which also helps with nerve function, which is nice. And then vitamin B5. But I think a lot of people think like, oh, B12, right? That's like the energy B vitamin.
That's a good point. Yeah, people do associate B12 with fatigue or energy. And it's true. One of the symptoms of B12 deficiency is fatigue. And as we get older, B12 is the only vitamin that we need a cofactor that is made specifically in our stomach to absorb it when it's in our diet, right? So there's a lot of ways of being deficient in B12 and not eating animal products at all, which is mostly where B12 is found. And two, just aging and losing the ability to make what's called intrinsic factor in the stomach. Because without intrinsic factor being made by the stomach, you can't absorb what you put in your mouth. So it's a common nutrient deficiency.
But not to supplement with it unless you have a known deficiency.
Yeah, I would say B12 could be tested rather easily. So I would only give it if there's a deficiency, unless you're vegan or there's evidence that you don't absorb it, right? So then you're not going to be absorbing it as you go forward, then you need to supplement it. And with B12, supplements should be either a spray or something that goes under the tongue.
To help with absorption.
To make sure that it's absorbed, yeah.
You were talking about ginsengs as being supportive for fatigue. And Siberian ginseng, it's not actually a ginseng, right?
That's true. We call it Siberian ginseng because the other ginsengs were already known to be used for endurance and stamina. And the plant that was used in Siberia, which got dubbed Siberian ginseng, is not a ginseng like as in a Panax species. All the other ginsengs, true ginsengs, start with the word Panax in their name. This one's Eleutherococcus. So Eleutherococcus is the actual Latin botanical term. So it's an Eleutherococcus species, not a Panax species. So it's called Siberian ginseng, but it's really not related from a botanical sense. This is interesting because when herbalists practice, when you're seeing a patient, you're picking a plant that does several things at once. And so I think of Siberian ginseng, Eleutherococcus, when someone might have more, not just fatigue, but maybe anemia, because it's known to help with red blood cell counts. And I might also think of withania for those people. Withania is the Latin term, but it's also called ashwagandha in Ayurvedic medicine. Those two in particular have evidence for supporting red blood cell production. Eleutherococcus is a little more stimulating and considered a little bit more of a warming from an energetic perspective, while withania is more calming, more sedating, a little more support for those who are more anxious. That said, withania is also in the Solanaceae family. So
that's a nightshade family.
Yes, that's the nightshade. So if someone is reactive to nightshades, tomatoes and peppers and eggplant, then they may react to withania. So I would not give that particular person a withania plant.
And in Ayurveda, ashwagandha is very supportive for people with vata dosha, which is kind of the thinner, quicker person who has like more tendencies to anxiety.
Okay, that makes sense.
Yeah. So it's somebody who is, they're always very cold. They're like the wind. They're aggravated by wind even,
Okay.
that kind of person. So just a little side there.
Yeah. And one last adaptogenic plant I want to mention because I think there's a caveat to this one. Rhodiola is out there as an adaptogenic plant for help with fatigue and endurance and energy, in particular mental energy. Rhodiola, it will make its way into a lot of formulas. It also can lower blood sugar in some people. The one thing about rhodiola is that it can cause higher anxiety in some people. And so rhodiola is the one that I'm careful with for that reason. While studies show that it reduces mental and physical fatigue and improves energy and especially processes in the brain, it can also exacerbate underlying anxiety. So just be careful. A little caveat to that one.
So I've seen formulas that have the different ginsengs and rhodiola. They're just kind of like a kitchen sink. That probably wouldn't be a good thing for someone to take because if, one of them doesn't play nice with them, you're not going to really know which one. I mean, so do you do combo supplements with patients, or do you just kind of do single agents?
I will often put several plants together, but I don't usually mix my adaptogenic plants. I'll choose the one that I think is most appropriate for that person. There is someone who wrote a great book on this, Aviva Ram. Aviva Ram wrote a great book on adaptogenic plants. She was an herbalist before she became a doctor. And she came out with a book a couple of years ago, I think. Maybe we can link to that. And it gives a good overview of all of these plants and of this whole HPA axis dysfunction that we're talking about. So I think she did a nice job on that.
Yeah, I just wanted to mention that because I think there are, it's kind of a trendy thing. It's kind of a goop thing.
It's what I call a shotgun approach.
Yeah. And so that might not, maybe it'll work for a while for someone, but you want somebody who knows what they're doing to recommend it specifically for you. So there are other supplements that can be helpful for fatigue, but those are more specific to what's going on with an individual.
Yeah. There's all sorts of testing one can do to figure out their own physiology and where they might need support. Organic acid testing is popular out there. There's nutrient evaluations. You can use red blood cells or plasma or serum to do some nutritional checks. I mean, I think that you can be very specific if you see a naturopathic physician, a functional medicine doctor. So we're not saying, there's a pathology. We're assuming there's no underlying pathology causing the fatigue. If the fatigue is persistent, despite the fact that you've already looked at every reason possible from a disease process, then it's probably a functional issue, and that's going to be better assessed by someone who is practicing functional medicine or naturopathic medicine.
Right.
So the interventions for patients post-treatment, according to NCCN guidelines, and we talked about a lot of these, but I just want to summarize. So they put it into non-pharmacological, and we hit on all of this: physical activity, psychosocial interventions, and that was the yoga, mindfulness-based stress reduction,
CBT,
cognitive behavioral therapy, and also the cognitive behavioral therapy for sleep as well, because if you don't sleep well, you're going to be fatigued. They also mention the acupuncture, which we talked about, nutritional measures, and bright white light therapy. And that is trying to get that 24-hour rhythm by doing bright white lights in the morning. And that does make their official guidelines. And so that's another way to entrain that 24-hour rhythmicity that can be thrown off due to treatment. They do talk about some pharmacological ways of getting your energy back.
Right. It's typically like methylphenidate, which is Ritalin, or a steroid, either Dex or prednisone. Yeah.
Yeah. And of course, as naturopaths, we're going to say that's a last resort, right? You really want to do this without having to resort to drugs if you possibly can. And then, of course, treating the underlying causes, which is a lot of drugs might be there for treating underlying issues, whether it's pain or other issues that are underlying the fatigue. So that's kind of the summary, mentioning everything we mentioned and a couple of things we didn't.
So we also covered some of the various herbs that can support the HPA axis, which is one of the big culprits when it comes to this ongoing fatigue after cancer treatment. Speaking of fatigue, we are well past our lunch hour. So I do want to mention our song for this episode. Whereas Shake It Out by Florence and the Machine is the song that encompasses all of the survivorship pod. Exhausted by the Foo Fighters is the song that I chose for this particular episode.
Should I know this?
No, I don't think so. I didn't really know it either.
Okay.
I just did a search and then played the song and I was like, okay, that works.
So I got to go to Spotify to hear it.
Yes, I will be putting that on Spotify and that'll get added to our playlist. And if y'all aren't following us on social media, we're on Instagram and we're on Facebook and sometimes on Twitter. We have a website where on occasion we post little interesting things, like whether it's a recipe or, teaching you something.
You don't sound very enthused.
I am fading fast.
This is Hypoglycemia 101. All right.
A lot of what we talk about, our links are in the show notes. We also have a Pinterest page that I am continuing to post links to. So it kind of depends on how you like to get your information. And as always, hit that subscribe button, drop a rating and a review. Tell us what you think of us. We can take it. We're grown-ups.
Just be nice.
Always.
I don't want to take it.
Always.
I don't want to take it. I want good news or no news.
Oh my. Okay. On that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaiser.
And this is the Cancer Pod.
Until next time.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaiser. Music is by Kevin MacLeod. See you next time.